Hello, everybody. So today we are going to be talking about social policy. So remember, domestic policy are things that are happening within the borders of the United States, and one of those things is social policy. So we're going to be looking at some various social welfare programs and things like that. Remember, the goal of this is just to kind of get a snapshot of various different policies as we go through this little mini unit. So on your notes, as you can see, we are going to compare entitlement and means tested programs today, and then also explain how different ideologies impact policy on various social issues. So we will get started here. Let me pull up my presentation. Okay. All right, so we've talked a lot about ideology. It's definitely been a minute since we've really dug into what those ideologies believe, but it's really important for this set of notes because, as you will see, these entitlement and means tested programs, when we're looking at social welfare, how do the conservatives, liberals, libertarians, how do they differ on what these types of programs and policies should look like, is very, very important and can come up on your AP test big time. And then we're also going to be looking at healthcare. We're going to be looking at environmental policy and energy policy as well. So our first question is, what is social policy? And social policy actually stems from the preamble of the Constitution, right? So right there in the preamble, this is the very first thing you see in the Constitution. It says, "We the people of the United States, in order to form a more perfect union or create a more perfect union, to establish justice, to promote the general welfare," right, "do ordain and establish this Constitution." So we, the people, to promote the general welfare, the safety, the well-being of our society. This is why we are creating this Constitution. But the question that has arisen, is what is the government's role? What is the government's responsibility to the welfare of its citizens? And this idea has changed over time, and it remains controversial today. And specifically, we do see a divide in our policies of social welfare, healthcare, education, even really split and divided along those ideological lines, which is what we will take a look at here in just a moment. So, I want to talk first about social welfare policies. And social welfare policies specifically are those programs that provide support and assistance to specific groups of people. Those could be the elderly, the disabled, those in need, families with needy children. And this is where a lot of controversy comes in because, when we're talking about welfare, I mean, think about what that word means to you, right? If you can come up with an image in your head, even though it comes right out of the preamble of the Constitution, that phrase often conjures images of maybe irresponsible recipients who might be taking advantage of those welfare payments from the government instead of working. Now, in truth, a lot of Americans do receive, at least at some point, benefits from the government in terms of social welfare programs. And I do think it's important to note the distinctions between social welfare policies in our country. So we're going to be focusing on the difference here between entitlements and means tested programs. So we're going to be defining those two things here and then looking at some other examples, like the big six, so to speak. So, what is an entitlement? Entitlements, I'm going to read the definition and then kind of get into this. Entitlements are financial benefits that you, as a citizen, have a legal right to use when you meet a certain eligibility condition that is established by law. Now, one of the things that sets this apart from a means tested program is that this is awarded regardless of need. And we'll talk about what that means here in a second. An example of an entitlement program is going to be Social Security, right? That is something that you pay into as a worker. And when you meet that retirement age, you are automatically given to it by law. You have a legal right to that money. Okay. Now, something that I want you guys to keep in mind, because we're going to be talking about, and I'll be showing you a graph later, this entitlement spending on programs like Social Security and others that we will see, is a part of what is called mandatory spending in our budget. So think about that word mandatory. right? If something is mandatory, it's required, right? It must be done. So that means entitlement spending, right? You are entitled to it. The government must spend that money on these entitlement programs because it is by the force of law. Then we have means tested or means testing programs. This is, again, a large part of the controversy because these are things that I think a lot of us think of when it comes to actual welfare, where applicants must meet eligibility requirements based on need, right? You have to qualify for these programs. You don't just automatically get it. So means testing means that an individual or family is eligible for assistance based on whether that individual or that family possesses the means to do so without help, right? So again, there's that based on need. You have to qualify, right? For example, you have to make below a certain amount of income, right, to be awarded some of these programs. So I wanted to show you eligibility for Medicaid, and we'll talk about Medicaid here in a second, but Medicaid is an example of a means tested program. So Medicaid is, as you can see, there are eligibility requirements to receive this. So it is based on income, right? It is based on things like non-financial eligibility. So, you have to live in a certain state, the medically needy, right? You have to qualify for these various things in order to receive Medicaid. Back into the presentation here, sorry. Okay, so let's briefly talk about the big six. These are often things that pop up in AP questions, so I want you guys to be familiar with that. So Social Security is something that we're going to focus on here next, but Social Security basically is the living wage for retired Americans. This is an example of an entitlement program. So all Americans who work pay a Social Security tax in order to receive this benefit. And we're going to look heavily at this here in the next couple of slides. Now, Medicare is also an entitlement. Okay, this is health coverage for retired Americans. All Americans who work pay a Medicare tax to receive this benefit upon retiring. So right there you can see it is a legal benefit that you are owed because you've paid into it. Now, on the flip side, let's talk about Medicaid, right? Medicaid is health coverage, additional health coverage potentially, for underprivileged Americans. You do have to pass a means test. You have to qualify for the program. Okay, that is Medicaid. So just going back to that, one of the things that tends to help my students, Medicare, right? We care for the elderly, right? Not saying we don't care for everybody else, but we care for the elderly once they've retired, right? And if you are in financial, need, you need aid in order to get health coverage. So that might help you making the distinction. Now, some other programs, unemployment benefits. Unemployment benefits are pay and health care for Americans who lose their job. This is, again, an example of an entitlement because actually you pay into unemployment. It is an option that you can. It's an entitlement that you would then be legally awarded. An example of a means tested program is food stamps, right? So you receive monthly stamps to help the underprivileged. If you need groceries, again, that is something you have to qualify for. It's not automatically given. And then veterans benefits and healthcare as well. This is an entitlement because if you are a veteran, if you are enlisted, you pay into this and then expect to receive those benefits as a result. So these programs provide healthcare and educational services for honorably discharged American veterans. Now, I think it goes without saying that these social welfare policies are expensive, right? Because we're helping to support those all who qualify, right, through Social Security, for example, or those who are in need. And it's important to note that this controversy stems from how much do people get, right? To what degree? How do they earn it? Right? So, for example, when we're looking at policies like Medicare, Medicaid, food stamps, we see a lot of these ideological divisions. And this is a section on your notes, so make sure you're paying attention to this. So conservatives, right, the right wing, tends to believe that these means-tested programs, things like Medicaid, like food stamps, for instance, discourage people from working, right? So they are, on average, less likely to be in support of these types of social welfare programs. On the other hand, liberals, Democrats, left leaning individuals are more likely to see the programs as a stepping stone, right? Helping people to weather and to get through difficult circumstances and more of a temporary measure. Okay, so just think about it from that ideological perspective. Okay, so let's take a look at Social Security because Social Security is our biggest social welfare program. It is our biggest entitlement program. And this is most likely what's going to come up on the AP test. So, historically, social welfare and family welfare in particular was a private concern, right? This was something beyond the scope of government. But that changes pretty quickly in 1935. We turn to the New Deal, right? There's FDR again, right? A lot of our government policies take root during this time period, like the Social Security Act of 1935. FDR was able to get this passed as part of the New Deal to deal with programs specifically, or sorry, not to deal with programs, to deal with the Great Depression and to establish a social safety net, right, for less fortunate Americans, right? Safety net, right, catches you if you fall down. So this is that kind of idea, right? We want to have a financial safety net in times of crisis for underprivileged Americans, right? Less fortunate, so to speak. Now, beneficiaries. If you are a beneficiary, that means that you are a recipient of. So those who are beneficiaries of Social Security and who receive Social Security checks, they are retired or disabled persons, and even surviving members of their families. So, how is it that one gets Social Security and how is it funded, right? Where does all of this money come from? So, it's funded through payroll taxes that are charged on employees and employers. And I think that's important to talk about because of an issue that we're going to look at here in a second. But if you ever take a look at your paycheck, if you have a job, you will see that you are paying into Social Security. Now, the average check is around $1,100, and that kind of changes with various policies. Now, let's take a look at the problem with entitlements, specifically the problem with our biggest one, which is Social Security. Okay. We're currently running into issues when it comes to this type of spending in particular, because what we have here is a chart. Okay, and this shows us the Social Security Trust Fund, right, where that money's going, how fast it's being depleted, how it's being collected, and this problem that we're facing today, sorry guys, the problem that we're facing today largely can be stemmed from the baby boom. And FDR and the government at the time in the 1930s couldn't predict this situation. But after World War II, we had a huge spike in population, right? Now, what we're seeing is those people who were born post World War II during the baby boom are now retiring, right? And they're retiring since 2010 and really into 2030. Right? That's going to be kind of the last kind of push of that time period. So we have a huge number of recipients who are retired and who are retiring now living off or going to be living off and gaining Social Security benefits. Now, that might not be so much of an issue. However, in 2022, our life expectancy is longer than it was when Social Security was established. So not only has the number of workers diminished, right? Not only has that gotten smaller as people are retiring, we're also not in a baby boom anymore. And the number of recipients who are retired are growing. They're staying alive longer due to benefits in healthcare, and they're staying alive longer to continue receiving these benefits. So this is depleting the trust fund a lot faster than we actually anticipated. Reports estimate that currently, if things continue the way they are, the trust fund, the Social Security fund, could be depleted as soon as 2033. So really not that far in the future. And this is an issue that we might see some reform and policies on in our lifetime. Yeah, there's a very good chance if things stay the course right now that you and I unfortunately might never receive what is a traditional Social Security check, because that is being depleted much faster than anticipated. Now, something else to keep in mind, we're going to be looking at, when we talk about Congress, the budget, what is mandatory versus discretionary. But if you remember, I had mentioned that entitlements are mandatory spending, right? So they have to, that money has to be spent on those programs. And over time, as you can see, right, mandatory spending from 1970 through 2023 projected is, basically predicted to double, right, in size. So what that means and has implications for is our money, our budget that we have to spend on other programs, other needs for the country is getting smaller and smaller. And that's something that we will take a look at when we talk about the budget and Congress. So to recap that, I know that was a lot, but I did want to kind of recap this here really fast. The big problem with this kind of situation here is older Americans are living longer, right? They're living longer, so they're retired for more years, which means they're costing, or it is costing more to fund Social Security, Medicare, right? Those entitlement programs. We have fewer working adults in America, so the total fertility rate is expected to be, 1.77 kids per family, which is down. And then there is a lack of consensus about how to fix the problem itself. And that is kind of where the ideology comes in. So, what do we do, right? Ideologically divided here. There are two main kind of camps or thoughts. So, we can raise taxes to maintain programming. Now, remember, you have ideologies that, one, liberals on one hand want to continue to provide for the social welfare programs, even if it means raising taxes, right? Whereas conservatives, on the other hand, do not want to raise taxes. They do not want to continue increasing that amount because they do believe that it could potentially cause dependency on these types of programs. But that is one of the solutions out of the situation. Another one is to cut entitlement programming, right? Again, you can cut programming. That means we don't have as many options, as many services for people. But that would also fix the issue of it costing too much. If we don't have to pay for so much programming, that does kind of relax the budget a little bit, right? And I'm sure you can assume that then those ideologies have different ideas on how that should be done or which one even should be followed. Okay, let's breeze through a few more policies here. So government and educational policy. Education, as we learned when we talked about federalism, deals with states and local governments. They're the ones that deal primarily with education. But the federal government does have a role. Today, most federal funds go to higher education in the form of student loans and grants. In the 1950s, we saw the government, really kind of extend its hand into public education for STEM programs in K through 12, particularly science, technology, engineering, and math. Right, we're competing against Russia during the Cold War, so we want to prove that we are the best in all of these fields. And then also in 2001 and even into today, we've seen the federal government pass laws like No Child Left Behind, the Every Student Succeeds Act, where standards were set at the national level, schedules for testing. And that program has been kind of controversial because it has imposed unfunded mandates, which, if you remember, are those requirements by states to meet federal guidelines. So unless they would like to receive consequences, whether fines or withholding funds, and today the government funds less than 10% of the total amount spent on education, but that doesn't mean it's completely out of the realm completely. Now, healthcare is another controversial issue that has been talked about a lot recently, specifically with this idea of national health insurance or universal health care. And that has really been pushed recently by, Bernie Sanders and other, politicians like Bernie Sanders. Harry Truman was actually the first president to start pushing for this type of program. But just some first things or quick things on healthcare in the United States. We spend $2.5 trillion a year on healthcare. And this is so high because we have, it's more expensive, right? The new technologies that we have add to cost. The better the healthcare, the more expensive it's going to be. And in our country, no one person, group, entity has primary responsibility for payment or control of the cost. So we also see inequities and access to healthcare. And you gain health coverage or coverage in healthcare through your employer, right? Your employer will purchase you a health insurance plan. You can buy individual plans, but they're more expensive. And what we see is small businesses not offering these programs to their employees because they're too expensive for them to purchase. So people have unequal access to quality healthcare in our country. Now, the government does play a role in healthcare through Medicare and Medicaid, which we looked at before, right? Medicare is an extension of Social Security, tacked on later as part of that entitlement program, caring for the elderly, those retired. And then Medicaid is that mean-tested program for those who are economically disadvantaged, who have to prove that they are below a certain income level. I think it's also important to talk about Obamacare when we look at how this has impacted healthcare. This is also the Patient Protection and Affordable Care Act. It was designed to extend health insurance coverage to millions of uninsured Americans and prevent insurance companies from denying coverage due to pre-existing conditions. It does require plans to cover a list of essential health benefits and preventative care, things like yearly physicals. Now, healthcare and government regulation. The government is also involved when it comes to medical research, regulation of food and drugs, whether it's gathering information on, monitoring healthcare, the FDA, right, through COVID vaccinations, even monitoring of cosmetics. The CDC, the Center for Disease Control, has been monitoring global health with COVID, alerting the public on regulating vaccines, the vaccine rollout, that kind of thing. Right, and then finally we move to the environment and energy. So again, we trace the history back to the 1960s and 70s under President Nixon. Forming the the EPA is the largest regulatory agency that deals with the environment and energy, looking at pollution, pesticides, radiation, waste. And since they are a regulatory agency, they are responsible for monitoring compliance to those regulations. One of the other things that the EPA does is require what's called an environmental impact statement, or an EIS, right? These are required whenever a new project is proposed, like building a post office, widening a road, any sort of building. And that impact statement is an investigation that has to be done to see how the environment would be impacted by that development. Something else to make note of is the Clean Air and Clean Water Acts. I'm not going to talk too much about those, but those are the acts that the EPA has to monitor for compliance. The EPA also monitors endangered species in our country and around the world, looking at those that are threatened and vulnerable on the list to make sure that they don't become extinct. The EPA also taxes chemical companies to create what's called the Superfund to deal with waste produced by these companies in case there is a spill that needs to be cleaned up. And it also deals and addresses global warming. Now, for energy is coordinated by the Department of Energy and created in the 1970s in the wake of the worldwide oil and gas shortage. Well, that's hard to say. But the major concern today is maintaining a cheap supply of energy that we depend on for our activities. Currently, we are seeing a dependence on Middle Eastern oil. We're also keeping a watchful eye on depletion of natural resources, damage to the environment. So our biggest goal are renewable and sustainable resources, whether that's wind, solar energy. We want to make sure it's sustainable. Okay, so I know that was a lot, but if you guys have any questions, that's going to conclude this part on domestic policy and social welfare policies. In our next video, we're going to be looking at a section of economic policy. Make sure to answer the key terms and or not key terms and concepts, but the key takeaway section on your notes, everybody. And highlight anything you want to ask in class. And I will talk to you soon. Bye.